Stewart Petersen. I'm Director of Education at this new dental school and also at the medical school. My background is in medical education, not dental education. And over the last 18 years, I've spent my time running a medical course just down the road from here. And over that time, I've seen huge developments in our understanding of how students learn professional skills and how we can facilitate that process more effectively. And my job is to try and bring those messages into the curricular development at the dental school here in Leicester. Now you might say, well, why bother to change it? You know, it worked all right for you, didn't it? You're all out there in practice at the moment. Why change the way in which education works? Well, when anyone says that to me, I always ask them to reflect on how much professional practice has changed over the last 15 or 20 years, and how that has been driven by research, development, new techniques, new approaches to doing things. And the same sort of development has happened in education through research and development and new techniques and new ways of doing things. So surely we would expect education to change in the same way that practice changes. I think it's been a little bit harder to do that in dental education than many other parts of the country, perhaps because of history. But we can do that here. And we can do that here because we're starting from scratch. But if you're going to change something, then there's inevitably a fear. And anyone who has been looking at education in schools over the last 20 years or so will be aware of the dangers of simply going with the latest fad or the latest fashion in education. We've all seen the consequences of that. And there's always a danger of that whenever you change. But there are lessons from medical education here. Medical education had to change a long time ago because of a driver from the GMC. And it was found that those schools who decided to abandon how things have been done in the past and try to adopt a latest fashion or fad have not prospered that well. But those who recognised that they had to change, but combined the good things from the past with new things and new thinking which has developed over the years, have gone on to prosper very well. So the trick is to keep what's good from what we did before, but bring in what is new from what we've established over the last few years. And that's exactly what we'll do here in Leicester. Thank you. And there's a trick to that. And the trick to that is based in fairly sound educational theory, which was expressed by a guy called Kees van der Vleuten in Holland a few years ago. And he said the 3 C's. And there are essentially 3 conditions that need to be met if you're going to generate a course, a learning experience that is effective. And those 3 conditions are, first, all the learning should be in context, contextual. In other words, the learners, the students who are going through the course should understand why they're learning everything they're learning and what they're going to do with it at the end of the course when they go on to practice their profession, in this case dentistry. So keeping the focus on the end point throughout the course, keeping everything in context. The second element is to design an experience which forces students into a style of learning which constructs understanding in their head which they can use, rather than simply learning lists of things which they then parrot out in an exam and forget 5 minutes later. And we've all done it, but actually that doesn't help. What you need is to learn things that will carry you through the rest of your professional career. And the third of the 3 C's is that we all learn better if we learn together, if we learn collaboratively. So you design learning experiences that enable students to work together. And that's what we'll do. Thank you. So if we think first of all about working in context, the key thing that you've already heard is that a student should understand from the very beginning why they're doing what they're doing. And one key feature of that is that they start clinical work at the very beginning of the course, because they can see what clinical work is, they can see how it's done, they can see the sort of things you need to know in order to be able to do it. But also, all the other things that they're learning early in the course need to be focused upon their application to that clinical work. And that means integration. All the different disciplines that contribute to dentistry, which you've seen on the slide earlier, all need to be brought together in the student's mind so they can select the relevant bits for whatever clinical problem they happen to be dealing with at any time. And so the course will be integrated. Integrated in the sense that all the things that students are learning at any one time are brought together and focused onto problems, but also integrated across the course, so that later in the course, things that are learned early are come back to and gone over again, so that their relevance to practice can be further established. Now, another way of establishing context is where you might all come in, and that is to make sure that many of the teachers, if not most of the teachers to whom the students are exposed very early in the course, are themselves practicing dentists, and who can set the learning that the students are doing at that time in their context. But we also want to change the way in which students learn. There's a terrible tendency, certainly from school, to learn things in nice bite-sized chunks, parrot them out in an exam, then forget about them. That doesn't work for professional practice. You have to build structures in your head which preserve understanding for your entire professional career so that you can use it repeatedly as you go through life. And there are ways to do that, and that is where the recent developments in education really come into their own. We understand how you have to craft an educational experience for a student to go through which forces them to develop understanding for use, not just rote learning for replication in an exam. And that involves using the right educational experiences at the right time. There will be lots of lectures in the course, because lectures are very good at introducing things, but lectures on their own don't really work. What you have to do is to immediately build on them by having activities in the course which the students engage in order to explore their understanding of the ideas that have been presented to them, and then work through the application of that understanding to practice. And so the students will be driven repeatedly around cycles of different things. Go to a lecture, go into some group work to explore the ideas, go into the simulation suite in order to see what you can do with those ideas, and later on in the course, go into practice and see what you can do with those ideas. So that understanding is constantly reinforced. And all of the assessment of the students will be assessment of their ability to apply what they understand to practice, not any other sort of assessment, not asking for just parroting things out. All of this will be aided by students working together. The students will spend a majority of their time in this course working in a group in one way or another. Early in the course, they'll spend their time in groups solving problems which are presented to them, building upon the material that they've heard about in the lectures. This is not problem-based learning, if you've heard about that, not at all. It's a different thing altogether. It's a crafted educational experience which the students undertake collaboratively in order to help one another learn. Later in the course, you've heard they'll be working in practices, and the same practices will work together throughout the course, working together to learn together, but also learning the invaluable skills of teamwork that are necessary for future practice. So by following these simple principles, we can design a curriculum from scratch, and that's a huge advantage which no other school has, starting from scratch and not being fettered by history. We can design a curriculum to be as effective as possible. Now you may just say, oh, it is this airy-fairy educationalist professor standing here, you know, arm waving around talking bullshit, and it's all. But actually, I'm not. There are principles here. And over the last 18 years, we've spent time applying those principles and finding hard, practical ways of making them work. And those hard, practical ways will be introduced into the curriculum here. And the effect of that will be twofold. One, to make the student learning experience both more enjoyable and more effective, in the sense it's less hard work for them. But second, and far more important than that, to ensure that they are thoroughly prepared for practice and whatever part of the world they go. And that is the sole focus of this entire enterprise. It's all about producing good dentists at the end of the day. And that's where I stop. Thank you.